Imagine you are just sitting in the emergency room. A 24-year-old woman is brought in, and she is having a severe panic attack.
Oh, wow. Yeah, those can be terrifying.
Right. She's hyperventilating. She's visibly terrified. But suddenly, she starts complaining that her fingers and her mouth are going completely numb.
Which is a huge red flag for something else going on.
Exactly. Now, most people in that waiting room, they're going to think she's having a heart attack. But the real culprit is actually much stranger. Her blood has essentially become a basic chemical solvent, and it is actively stripping the usable calcium right out of her circulation.
It's wild how fast things can escalate.
It really is. Your body is a master chemist, and today we're taking a deep dive into what happens when that internal chemistry lab just goes completely rogue.
Yeah, we are looking at a really fascinating stack of clinical medical case studies today.
We really are.
Yeah.
And they're all focused on this one incredibly delicate tightrope, which is your acid-base balance.
It is a remarkable survival system, honestly. We're essentially going to play medical detective with these clinical files.
I love that. Medical detectives.
Right. So the goal here is to walk through the diagnostic steps for these real patient scenarios, figure out the root cause of their chemical crisis, and then, well, we'll watch how the body frantically attempts to save itself.
And it does get frantic.
Oh, absolutely. Every case we look at today comes down to a battle between two primary systems. You've got the respiratory system, meaning the lungs, and the metabolic system, which usually points to the gut or the kidneys.
Okay, so before we jump to that first patient, I feel like we need to establish some ground rules.
Yeah.
Because the numbers in these files are genuinely terrifying if you don't know what the normal baseline is.
That is very true. You need the context.
Right. Let's set up a mental image for you listening. Think of your body's pH balance like a highly sensitive thermostat in your house.
Okay, I like that analogy.
But instead of balancing hot and cold, this thermostat is balancing acid and base. And the settings on this thermostat are just incredibly strict. A normal blood pH has to stay right between 7.35 and 7.45.
Which is a tiny, tiny window. I mean, if your blood drops to 7.2 or goes up to 7.6, your cellular enzymes literally stop working.
Which is bad.
Very bad. You enter a critical, life-threatening state. So to keep that tight window, the body uses two HVAC systems. The carbon dioxide in your blood, or CO2, that acts as the acid.
Okay.
And that is managed by your fast HVAC system, which is your lungs. You can blow off CO2 or hold on to it literally minute by minute.
That's adjustments. Got it.
Exactly. On the other side, bicarbonate, or HCO3, that's the base, and that is managed by the slow HVAC system, your kidneys.
So just to recap that, the lungs handle the acid and the kidneys handle the base.
You got it.
And the files make it super clear that when one of those systems breaks down, the other one goes into absolute overdrive to compensate for it. But their reaction times are wildly different.
Yeah, they really are.
The lungs, which is the respiratory compensation, that can kick in within minutes. But renal compensation, the kidneys, that is a really slow, methodical process.
It's very slow. It actually takes the kidneys 3 to 5 days to become fully effective at retaining bicarbonate and excreting acid.
3 to 5 days.
Yeah. And if a patient is in a sudden metabolic crisis, they do not always have 3 to 5 days to just wait for their kidneys to wake up.
Wow. Okay, so let's see what that looks like in practice. Let's start with the fastest system in the body, the lungs. What happens when our breathing rate is the actual cause of the pH crisis.
This is where it gets interesting.
Right. And this takes us right back to that 24-year-old woman in the ER with severe anxiety. Her respiratory rate is just through the roof.
Yeah, she is in a state of extreme hyperventilation. And by breathing that fast, she is rapidly blowing off huge amounts of carbon dioxide.
Which we established is the acid.
Exactly. Normal CO2 in the blood should be between 35 and 45 millimeters of mercury. Hers is just plummeting. Since CO2 is our primary acid, she is essentially blowing all of her acid out into the room.
Oh, wow.
So her blood pH shoots way up past 7.45, making her blood way too basic. And the medical diagnosis for this is respiratory alkalosis.
Respiratory alkalosis.
Yeah.
Okay, which brings us back to the numb fingers. I really want to unpack this because, if I'm having a panic attack and my hands cramp up and go numb, my panic is going to completely skyrocket.
Oh, for sure. It's a terrifying feedback loop.
So what is the actual chemistry behind that specific symptom?
Well, the symptom itself is called paresthesia, and it's a direct result of that high pH. The alkalotic state literally changes the electrical charge on a protein in the blood called albumin.
Okay.
And this altered protein It suddenly acts like a powerful magnet. It just binds up all the ionized calcium that's floating around in her bloodstream.
Wait, so she didn't actually lose any calcium from her body. It's just, like, certainly handcuffed to this protein so her nerves can't use it.
That is a perfect way to describe it. Yeah. The total calcium is exactly the same, but the ionized, usable calcium drastically drops.
That is crazy.
And that deficit causes immediate neuromuscular excitability. Nerves start firing spontaneously, and that causes the tingling around the mouth and fingers. It can even lead to these involuntary muscle contractions called tetany.
So how do you even treat her? Like, if you just give her an IV of calcium, aren't you kind of ignoring the actual problem?
You'd be totally missing the root cause, yeah. The treatment is to fix the HVAC system. You have to stop the hyperventilation.
Oh, right.
You coach her breathing. Maybe you use a paper bag to help her rebreathe some of that exhaled CO2. And as the acid builds back up in her blood, the pH drops back down to normal.
And then the protein lets go of the calcium.
Exactly. The albumin releases the calcium and the numbness just vanishes.
That is absolutely fascinating.
Mm.
Okay, let's look at the dark mirror to that case.
Let's do it.
The files outline two patients who are basically the exact opposite of that anxiety patient. We have a post-operative patient recovering with heavy narcotics, and an 8-year-old boy suffering from severe pneumonia and a pleural effusion, which is basically fluid around his lungs.
Right. And both of these patients have severely depressed respiratory rates. Narcotics directly suppress the brain's drive to breathe.
It just totally shuts it down.
Pretty much.
Right.
Meanwhile, the 8-year-old with pneumonia has impaired lungs that physically just cannot exchange gas properly. He is taking a lethargic, incredibly dangerous 8 breaths per minute.
8 breaths a minute. Normal is what, like 12 to 20?
Usually closer to 15 to 20 for a child that age. He is barely ventilating at all. His oxygen saturation is sitting at a critical 82%, and he's only really responding to painful stimuli.
Man. So the anxiety patient blew off all her acid, but these patients are basically hoarding it.
Okay, Clay.
The CO2 is just backing up into their bloodstream like exhaust in a closed garage.
And that exhaust drops their blood pH incredibly fast. The 8-year-old's lab work confirms a severe respiratory acidosis.
Which means too much acid from breathing.
Right. His pH has fallen to a highly toxic 7.26, and his CO2 is skyrocketing at 68, which is way above that normal maximum of 45.
That's terrifying.
It is. The blood vessels in his brain are actually dilating in response to all that CO2, which is contributing to his depressed mental state.
I'm looking at his labs right now, and I'm just trying to figure out the fix here. Because if his lungs are the ones causing the problem, like, they're physically impaired by pneumonia, can his body even fix itself?
Not quickly enough to save him, unfortunately. Since the lungs are broken, the body has to rely on the slow HVAC system.
The kidneys.
Right. The kidneys notice the acidic blood and start working to retain bicarbonate, the base, and excrete hydrogen ions into the urine. But remember, our ground rules, that process takes 3 to 5 days.
And an 8-year-old with an oxygen saturation of 82% does not have 5 days.
He barely has 5 minutes. This is why the priority medical intervention here is immediate intubation and mechanical ventilation.
We have to breathe for him.
Exactly. The medical team has to physically force that CO2 out of his system because his renal compensation is just way too slow.
It's just a terrifying race against the clock.
It really is.
But the files also highlight a really tricky middle ground that I found super counterintuitive.
The asthma exacerbation.
Yes, the acute asthma exacerbation.
Right.
A patient comes into the ER, and they are working incredibly hard to breathe. They're wheezing, taking like 34 breaths a minute.
Right.
Now, based on what we just learned, 34 breaths a minute means they're hyperventilating. So they should be blowing off CO2 and getting too basic, right?
Initially, yes, they do. They actually start out in respiratory alkalosis, just like our anxiety patient.
Oh.
But an asthma attack is fundamentally different from a panic attack because there is a physical obstruction. The airways are narrowed, they're inflamed.
It's like breathing through a straw.
Exactly. The patient is using accessory muscles, their neck, their chest, just to force air through those tiny straws.
And those muscles can only work that hard for so long.
That's the trap. Eventually, the respiratory muscles exhaust themselves. The patient tires out. Their breathing might slow down, or it might just become shallow and ineffective.
Oh, wow.
And at that moment, they decompensate. They stop blowing off the CO2, and the acid rapidly builds up. They flip abruptly from respiratory alkalosis entirely over into a lethal respiratory acidosis.
That is so deceptive. I mean, a parent might look at their child having an asthma attack, see their breathing finally slow down, and think, oh, thank God they're calming down.
Yeah.
But chemically, they are actually crashing.
The clinical notes explicitly warn about this. A normalizing respiratory rate in an exhausted asthma patient is a massive red flag. It requires intense vigilance because they're losing their ability to ventilate.
Wow. Okay, so we've seen the chaos the lungs can cause when they break the system. But what if the lungs are doing their job perfectly and the blood still turns into this toxic acidic sludge?
Then you look elsewhere.
Right, that usually means the chemical spill is coming from somewhere else entirely. So let's look at primary metabolic causes, which very often start in the gut.
The sources provide a very clean rule of thumb for this. If you are losing massive amounts of bodily fluids, the location really matters.
Okay, what's the rule?
Losing acid makes your blood alkalotic. Losing base makes your blood acidotic.
All right, applying that rule, we have a 55-year-old man admitted with severe gastroenteritis who has been vomiting for 4 days straight. And we have a 38-year-old female with a history of bulimia nervosa who has been self-inducing vomiting multiple times a day for 2 weeks.
The mechanical loss in both of these patients is identical. They are continuously purging stomach acid, specifically hydrochloric acid.
Okay, so losing acid makes the blood basic, so their diagnosis is metabolic alkalosis.
You got it. And the lab results for the bulimia patient show us how catastrophic this can get. She was actually admitted after passing out.
Oh, man.
Her blood pressure is dangerously low. It's at 88/56. Her pH is incredibly high at 7.53. Normal bicarbonate base is between 22 and 26, but hers is a massive 37.
That's a huge spike.
It is. But the real immediate danger highlighted in her chart isn't just the pH, it's her potassium.
Yeah, I noticed that in the file. Her potassium is at 2.8, which the notes flag as critically low. Why does vomiting deplete potassium, and why is that so dangerous?
Well, the body loses some potassium directly through the gastric fluid, but the bigger issue is the kidneys. As the kidneys try to hold on to hydrogen to fix the alkalosis, they end up dumping potassium in exchange.
Oh, it's a trade-off.
Exactly. And this condition, hypokalemia, it just wreaks havoc on electrical signals in the body. It causes severe muscle weakness. I mean, she could barely stand, and critically, it destabilizes the heart.
Which leads to arrhythmias.
Yes. She is at high risk for lethal cardiac arrhythmias. And just to compound the misery, her high pH is also binding up her calcium, just like our anxiety patient, which is causing muscle spasms.
It just cascades.
Yeah.
So vomiting throws your acid out the window.
Yeah.
What about the other end of the GI tract? We have an 8-year-old child with a viral stomach bug having 10 to 12 severe watery stools every single day.
Diarrhea means the loss of intestinal fluid. And unlike the stomach, the intestines are a highly basic environment. They are very rich in bicarbonate.
So he is literally flushing his base down the drain. Diagnosis? Metabolic acidosis. His labs show a pH dropping to 7.29, and his bicarbonate base has been heavily depleted, down to 18.
Which is an emergency.
So the big question here, how does the body compensate for this? The gut is totally malfunctioning, and we know the kidneys are way too slow to keep up with that level of fluid loss.
It calls in the rapid response team, the lungs.
Well, of course.
Let's look at the bulimia patient first, the one with metabolic alkalosis. Her blood has way too much base. To compensate for that, her brain tells her respiratory system to actively slow down.
Wait, really?
Yeah. Her respiratory rate upon admission was an unnaturally low 11 breaths per minute.
Because her body wants to hoard CO2. It's deliberately hypoventilating to build up enough respiratory acid to cancel out all that metabolic base.
It's an incredibly elegant defense mechanism, and the exact opposite happens for the 8-year-old with severe diarrhea. He is in metabolic acidosis, so his blood is drowning in acid.
So he needs to get rid of it.
Right. His respiratory system kicks into high gear. His respiratory rate was measured at 30 breaths per minute. He is tachypneic, frantically blowing off CO2 just to get rid of acid and pull his pH back up toward normal.
That is so cool. The lungs are literally playing damage control for the gut.
It's brilliant.
It really is. But what happens when the body isn't just losing fluids, but actively manufacturing its own acid? Because that brings us to one of the most critical case studies in this whole stack.
Ah, yes. Diabetic ketoacidosis, or DKA.
Right. We have a 22-year-old male with type 1 diabetes who presents to the emergency room with an altered, confused mental status. He ran out of his insulin 2 days ago, and his blood sugar is sitting at a massive 485.
And just for context, a normal fasting blood sugar is around 100.
So without insulin, all that glucose is just trapped, floating around in his bloodstream. The cells are physically surrounded by sugar, but they are starving because they can't unlock the door to actually use it.
And a starving cell gets desperate. Since it cannot use glucose for energy, the body flips this evolutionary switch and starts rapidly breaking down its own fat stores for fuel.
Makes sense.
But the chemical byproduct of burning fat is ketones, and ketones are highly, highly acidic.
So his own liver is basically just flooding his circulatory system with acid.
Massive amounts of it, yeah. His blood gas results are super alarming. His pH has plummeted to 7.28, and his bicarbonate base has been crushed down to 16 as it tries to neutralize that ketone flood.
Man.
So the diagnosis is severe metabolic acidosis, and he is also profoundly dehydrated. All that excess sugar in his blood acts like a sponge as it passes through the kidneys. It pulls huge amounts of water with it into the urine, a process called osmotic diuresis, which leaves his vascular system totally dry and just compounds the whole crisis.
But his physical exam gives us a fascinating detail. He's breathing incredibly heavily, taking these deep, rapid breaths, and there's a distinct fruity odor to his breath from the ketones. The files call this Kussmaul breathing. But wait, I'm trying to score this with what we learned earlier. In the very first case, fast breathing was the bad guy. It caused the respiratory alkalosis. Is this patient just panicking because he's so sick?
It is definitely not panic. It is a calculated, desperate rescue mission.
Really?
Yeah. This is respiratory compensation happening right in front of you. The primary problem here is metabolic, right? The overwhelming flood of ketones. The kidneys just can't excrete them fast enough.
Okay.
So the lungs pull double duty. The brain triggers this incredibly deep, rapid Kussmaul breathing to blow off as much CO2 as physically possible.
Oh, I see it. Getting rid of the respiratory acid, the CO2, lowers the total acid load in the blood, which buys the body a little more time against the metabolic acid.
Exactly. The body knows it cannot stop the ketone production without an injection of insulin, so it tries to dump acid the only other way it knows how, by literally exhaling it.
That is unbelievable. His body is literally trying to breathe out a diabetes crisis. The physiology of that is just mind-blowing.
It tells you exactly what the underlying chemistry is doing, provided the medical team actually knows how to read the signs.
Which really brings it all together for you listening. Your body is just this continuous, delicate dance of compensation. If your lungs fail, say, from pneumonia or taking too many narcotics, your kidneys will slowly step up over a few days to fix the pH by hoarding base.
That's the slow system.
Right. But if your gut or your internal metabolism fails, like from severe vomiting, diarrhea, or diabetic ketoacidosis, your lungs will immediately hijack your breathing rate to save you.
It is a phenomenal partnership. But there is a vital warning hidden in these files about what happens when medical intervention accidentally interferes with those emergency protocols.
Yes. I really wanted to bring this up because it's a medical paradox from the sources that totally flips common sense on its head.
It really does.
Most of us assume that if a patient comes in struggling to breathe, slapping an oxygen mask on them is just the universally right move. But the files specifically warn about patients with chronic obstructive pulmonary disease, or COPD.
This is where understanding the underlying chemistry becomes a literal matter of life and death. Patients with severe COPD live with chronic hypercapnia.
Which means what exactly?
That means because their lungs are permanently damaged, they can't exhale efficiently, so they constantly have high levels of CO2 trapped in their blood.
Oh, so their internal thermostat is essentially broken. They live in a baseline state of being slightly too acidic all the time.
Yes, and their bodies adapt to survive it. In a healthy person, the brain's drive to breathe is triggered by high CO2. Your brain senses CO2 building up and it tells your lungs, hey, take a breath.
Makes sense.
But a COPD patient always has high CO2. If their brains still use that trigger, they'd be hyperventilating 204/7. So the brain rewires itself, it shifts gears. For a severe COPD patient, the drive to breathe is no longer triggered by high CO2, it is triggered by low oxygen.
Wow, it's called the hypoxic drive.
Exactly. Now imagine that patient comes into the emergency room having a hard time breathing, and a well-meaning clinician just slaps a massive high-flow dose of pure oxygen on them. I'll leave you to ponder the chemistry of why that happens and what that suddenly fully oxygenated brain is going to tell the lungs to do next.
Yeah, if the brain thinks there's plenty of oxygen, it might just stop telling the lungs to breathe at all. It really makes you realize how finely tuned our internal thermostats are and, how easily we can break them if we don't understand the chemistry. Keep an eye on your own internal HVAC systems, everyone.